There is one critical action, more powerful than any medication in your home cabinet, that can stop the course of a stroke and protect the brain from irreversible damage. This action isn't a complex medical maneuver. It is an immediate decision that turns doubt into certainty and hesitation into response. This action is speed. In the context of a stroke, time is the primary enemy. When a stroke begins, a race against time begins with it, one that cannot tolerate delay. With every minute that passes, the brain loses approximately 2 million neurons. These cells do not return, and when they die, they take with them the ability to speak, to move, or to remember. Interrupting. A stroke means interrupting this accelerated cellular death. To understand how we defeat this adversary, we must know its mechanism. The brain is the body's command center, consuming an immense amount of oxygen and energy, delivered through a complex network of blood vessels. A stroke is a sudden interruption of this vital supply. There are two primary types. The first and most common is the ischemic stroke. Here, a blockage occurs. A blood clot, or a piece of fatty plaque, travels and blocks a cerebral artery. The area supplied by that artery is suddenly deprived of oxygen, and its cells begin to suffocate and die. The second type is the hemorrhagic stroke. Here, there is no blockage, but a rupture. A weakened artery in the brain tears, and blood leaks directly into the surrounding brain tissue. This blood does not nourish the cells. It is toxic to them. It creates immense pressure inside the skull, crushing and destroying healthy tissue. In both cases, the result is the same, the death of a part of the brain. Your first weapon for interruption is immediate recognition. You cannot fight what you cannot see. These signs appear suddenly and without warning. Memorize them well. First, balance. Is there a sudden loss of balance or severe dizziness? Does the person feel the room is spinning, or are they suddenly unable to walk in a straight line? Second, eyes. Is there a sudden loss of vision in one or both eyes? Is it a sudden blurriness or double vision that wasn't there before? Third, face. Ask the person to smile. Do you notice one side of the face drooping and not responding? Does the mouth appear uneven? Fourth, arms. Ask the person to raise both arms in the air. Does one arm drift downward involuntarily? Do they feel a sudden weakness or complete numbness on one side of the body, either the arm or the leg? Fifth, speech. Ask the person to repeat a simple sentence. Is their speech slurred or heavy? Are they struggling to find words, or are they using strange and inappropriate words? Or worse, are they unable to understand what you are saying to them? Sixth, time. If you notice any of these signs, even just one, this is the time to call emergency medical services in your country immediately. Adding balance and eyes is vital, especially for older individuals, as these may be the most obvious initial symptoms. Now, we come to the decisive action. What exactly do you do in this moment? Step 1, and most important, call emergency services immediately. This is the single most life-saving action. Do not waste time calling a friend or relative. Do not call the regular doctor's office for an appointment. Every minute you hesitate is millions of neurons dying forever. Step 2. Note the exact time the symptoms began. Look at the clock. When did the first sign appear? When did this start? This will be the first question the paramedics and the emergency team ask you. Why is this time so critical? Because there are powerful drugs, called thrombolytics or clot busters, that can dissolve the clot causing an ischemic stroke and restore blood flow. But these drugs must be given within a very narrow time window, often just 3 to 4.5 hours from the onset of symptoms. If you don't know the time, the patient may lose the chance for this revolutionary treatment. Step 3. Do not give any medication whatsoever. Your first impulse might be to give the patient an aspirin, thinking it will help dissolve the clot. This is a critical and potentially fatal mistake. Remember, some strokes, hemorrhagic, are caused by bleeding. If you give aspirin, a blood thinner, to someone having a hemorrhagic stroke, you are catastrophically worsening the bleed. At home, you can never know which type of stroke it is. Only a CT scan in the hospital can determine that. Step 4. Do not give the person food or drink. A stroke can affect the muscles responsible for swallowing. Giving them water could lead to choking or aspiration, where the water goes into the lungs, causing a severe pneumonia. Step 5. Try to keep the person awake and calm. Reassure them that help is on the way. Place them in a comfortable position, preferably on their side if they feel nauseous. Step 6. Do not drive to the hospital yourself. Never attempt to drive yourself or the patient to the hospital in your private car. It may seem faster, but it is not. First, symptoms could worsen during the drive, potentially causing an accident. Second, and most importantly, treatment begins in the ambulance. Paramedics are trained to manage stroke. They will monitor oxygen, check the heart, establish an IV line, and, critically, they will call ahead to the hospital to activate the stroke team. When you arrive by ambulance, the specialized team, neurologists and radiologists, is waiting for you at the door, ready to take you directly to the CT scanner. If you drive yourself, you start from zero in the waiting room, wasting precious brain-saving time. Sometimes the body sends a warning shot. This is called a transient ischemic attack, or TIA. The symptoms are exactly the same: facial droop, arm weakness, speech difficulty, but they only last for a few minutes, perhaps 5 or 10, and then they completely disappear. Everything goes back to normal. Many people ignore this. They think, that was just a strange feeling, but I'm fine now. This is a grave mistake. A TIA is a 5-alarm fire. It means a temporary blockage occurred and then resolved. But it is definitive proof that there is a serious underlying problem, and that a major, full, permanent stroke is on the way, often within the next few days or weeks. Never ignore a TIA. Even if the symptoms are gone, call emergency services or go to the hospital immediately. This is your golden opportunity to interrupt the major stroke before it even begins. The truest interruption of a stroke doesn't begin in the moment of crisis. It begins years before. The best method is to prevent it from ever happening in the first place. This is the core of brain health. First, know your numbers. There are 3 vital numbers: blood pressure, this is the silent killer, and the number 1 cause of stroke. Persistent high blood pressure damages the delicate artery walls in the brain, making them brittle and prone to blockage or rupture. Your target should be less than 130/80. Measure your pressure regularly. Cholesterol, bad cholesterol, LDL, builds fatty plaques inside your arteries, narrowing the pathway for blood. This is atherosclerosis, blood sugar. High blood sugar, even if it hasn't reached the stage of diabetes, makes the blood thicker and damages fine blood vessels. Second, lifestyle shields. Diet. Focus on whole foods. A Mediterranean-style diet is excellent. Think leafy greens, berries, nuts, fatty fish rich in omega-3s, and olive oil. Most importantly, drastically reduce your sodium, salt intake, as it is the primary enemy of blood pressure. Conversely, increase potassium intake, found in bananas, avocados, and spinach, as it helps balance sodium's effect. Movement. You don't need intense training. A brisk 30-minute walk daily keeps arteries flexible and helps control weight and blood pressure. Look at the clock. When did the first sign appear? When did this start? This will be the first question the paramedics and the emergency team ask you. Why is this time so critical? Because there are powerful drugs called thrombolytics or clot busters that can dissolve the clot causing an ischemic stroke and restore blood flow. But these drugs must be given within a very narrow time window, often just 3 to 4.5 hours from the onset of symptoms. If you don't know the time, the patient may lose the chance for this revolutionary treatment. Smoking cessation. If you smoke, quitting is the single most important preventative action you can take. Smoking thickens the blood, raises blood pressure, and directly damages the lining of your arteries. Weight management. Losing just 5% to 10% of body weight can significantly improve all risk factors: pressure, cholesterol, and sugar. Third, additional risk factors to address. Atrial fibrillation. This is a common type of irregular heartbeat. It causes the heart to pump inefficiently, allowing blood to pool and form clots in the heart. These clots can then launch directly to the brain. Sleep apnea, loud snoring, and frequently waking up at night might be a sign of obstructive sleep apnea. This condition causes sharp fluctuations in blood pressure and oxygen deprivation at night, placing enormous stress on the heart and brain. Interrupting a stroke happens in two moments. The first is the quiet moment, the daily choices you make to protect your arteries for the long term. The second is the moment of crisis, immediately recognizing the signs, breaking through hesitation, and calling emergency services instantly. Always remember, when it comes to the brain, time is brain. Do not wait, do not guess, do not hesitate. Your rapid response is the only line of defense. Look at the clock. When did the first sign appear? When did this start? This will be the first question the paramedics and the emergency team ask you. Why is this time so critical? Because there are powerful drugs, called thrombolytics or clot busters, that can dissolve the clot causing an ischemic stroke and restore blood flow. But these drugs must be given within a very narrow time window, often just 3 to 4.5 hours from the onset of symptoms. If you don't know the time, the patient may lose the chance for this revolutionary treatment.